Hi everyone, I'm Dr. Osman, a cardiology fellow. Today we're supporting Go Red for Women and raising awareness about women's heart health. We're wearing red today to remind everyone that heart disease is still the number one killer of women. But the good news is much of it is often preventable with early awareness and prevention. I'm here with Dr. Anderson, an interventional cardiologist who takes care of some of the sickest patients and literally opens blocked arteries to save lives every day. Dr. Anderson, thank you so much for joining me today and doing this with me. I wanted to ask you a few questions that I think will really help women better understand their heart risk and what they can do to protect their heart. All right, so from what you see in the cath lab, what is the one thing about heart disease in women that most people still don't understand?
Most people assume it's the same as in men, and we know that it's not the same as in men. Most men will present with a blocked artery, major epicardial artery, and women present with things like sudden cardiac or coronary artery dissection. Lots more likely to have coronary artery spasm. Also, a lot of women have something called microvascular dysfunction, which is not the big vessels, but the smaller vessels of the heart, and that's what we'll see sometimes in the cath lab.
That's such important points, Dr. Anderson. Thank you for bringing that. My second question: what symptoms in women are most often missed or dismissed that you wish every woman would take seriously?
I think the top three are shortness of breath. That's a really common symptom for women that are having issues with heart disease. Excessive fatigue, that's one of the major ones that people underplay and ignore themselves. Not only do their providers ignore it, but the females themselves say that, oh, it's just I'm getting older and I'm just more tired, dehydrated, I was up late last night, whatever those excuses may be. But that is something that is a very, concerning, symptom to be having. Things like nausea with shortness of breath, definitely chest discomfort of any form, and neck and back pain can even be an issue with heart disease.
If you could tell every woman one thing she should start doing today to lower her heart risk, what would that be?
There's a Know Your Numbers campaign that's really popular, and that's kind of the most important thing. You do need to know if you're a diabetic. You need to know what your A1C is. You need to know what your blood pressure is running, and you need to know what your cholesterol is, because all of those factors play a major role in women developing heart disease. Also, smoking, things like smoking and blood pressure, especially after menopause, as well as having diabetes, disproportionately affect women as far as they're much more stronger risk factors for heart disease. And even in men, they actually have more, devastating effects on women.
Wow, those are such good points, Dr. Anderson. My last question: for women watching this, especially busy professionals, moms, and caregivers, what is the first step they should take this week to check on their heart health?
Definitely get screened. You have to get screened, but also just listen to your intuition and your body. You know your body better than anybody else will. And if things don't feel right, they're probably not right, and you need to get checked out.
Thank you, Dr. Anderson. So today is Go Red for Women, but heart health is something we have to think about every single day. Heart disease is still the number one killer of women, but awareness, prevention, and early action can truly save lives. So, everyone, know your numbers, listen to your body, and never ignore symptoms that don't feel right. Thank you, Dr. Anderson, for the incredible work you do for your patients. And to everyone watching, take care of your heart and check on the women in your life too.